Itching in that spot. Be careful, it could be cancer. Have you ever felt a persistent itch in a sensitive area of your body and just ignored it, thinking it was something temporary? What if I told you that discomfort might actually be one of the first signs of something way more serious? The truth is, symptoms that seem simple can hide serious diseases like cancer. And the worst part, many people only notice it when it's already too late. In this video, you'll understand how your body gives clear warning signs and why you should never ignore them. Throughout the video, I'm going to show you several symptoms that could indicate cancer and that, most of the time, go unnoticed. And at the end, I'll reveal a very specific symptom, super common, but which might be the most dangerous of all, itching in a certain part of the body. Are you ready to find out what your body's been trying to tell you? Let's get started. Number 12. Difficulty healing wounds. Have you ever had a wound that just won't heal? That could be a major warning sign. Wounds that stay open for weeks, bleed easily, or have uneven edges need your attention. Even though it might seem simple, this kind of symptom can point to cancer cells stopping your body's natural healing process. It's a detail that often goes unnoticed, and that's why it's so dangerous. When the immune system is compromised, like in cancer cases, the body struggles to fight infections and regenerate tissue. This happens especially in diseases like leukemia, where the blood doesn't properly defend or clot. Also, cancers like skin or mouth cancer can show up as wounds that never heal. Paying attention to this kind of behavior is key for early diagnosis. Small sores can hide big problems. One of the most common mistakes is thinking these persistent wounds are just everyday cuts or scrapes. Many people just put ointment or cover the spot without seeing a doctor. This lets time pass, and the tumor keeps developing silently. The human body has an incredible ability to heal, so when that doesn't happen, something's wrong. A stubborn wound can be more than just a nuisance. In older people or smokers, for example, mouth sores that don't heal can be a strong sign of oral cancer. In sun-exposed areas like face, ears, and hands, a persistent wound might be linked to skin carcinoma. These symptoms are silent, discreet, and often painless, which makes them even easier to ignore. So it's not enough to just look at the wound. You need to watch how it changes over time. Time is critical here. The earlier cancer is diagnosed, the better the chances of cure and the less impact on the body. If a lesion stays for more than 15 days with no signs of healing, it's essential to seek specialized help. A simple test can clarify the cause and save lives. Don't wait for pain to act. No pain doesn't mean all is fine. Some tumors grow quietly. So, be alert. Wounds that don't heal shouldn't be neglected. Whether on the skin, mouth, or other parts of the body, persistent wounds are one of oncology's biggest red flags. Taking care of your health also means paying attention to the small signals your body sends. After all, ignoring these signs can be costly, and in this case, the price could be your life. Number 11. Unusual swelling. Swelling that appears out of nowhere and doesn't go away should be taken seriously. When your body holds fluids in places like the abdomen, face, or legs with no clear cause, it could mean something is wrong. Tumors, especially in organs like the liver, ovaries, or kidneys, can compress vessels and make blood flow difficult, causing swelling. This buildup may start subtle, but tends to get worse over time. Ignoring this symptom can delay diagnosing serious conditions. Often, swelling isn't painful, so people treat it like something temporary. Some try diuretics or change their diet, which can mask a much bigger problem. When swelling is caused by a tumor, it won't disappear with simple measures. It stays, spreads, or worsens, and that needs careful attention. This is a quiet sign that the body is fighting hard. Abdominal tumors, for example, can cause ascites, fluid accumulation inside the belly causing distension and discomfort. This symptom is common in gynecological and digestive cancers and is often mistaken for weight gain or gas. Swelling in the lower limbs might mean lymphatic obstruction caused by lymphomas or metastases. The body signals when something's wrong. It's essential to listen. Also, check if swelling comes with other symptoms like fatigue, loss of appetite, or a heavy feeling. When symptoms combine, it's more urgent to seek medical help. Often only imaging tests can identify the cause, reinforcing the importance of proper investigation. Better to be too careful than negligent. Recurrent swelling, especially if asymmetrical or on one side, can reveal severe internal changes. Being aware of these signs can be key to an early discovery that completely changes the disease prognosis. When caught early, cancer can be treated much more effectively. Don't underestimate any unusual swelling. Keep watching, because in the last part of this video, I'll reveal the worst sign of all, the one you should never ignore. Number 10. Changes in bowel or urinary habits. Sudden changes in bowel or bladder habits deserve extra attention. If you start having frequent diarrhea, constipation that won't improve, or notice a change in stool shape, it could be related to intestinal cancer. Similarly, frequent urination with pain or burning may be signs of bladder or prostate cancer. These are subtle but persistent changes indicating body dysfunction. Many people ignore these symptoms or blame diet, stress, or aging. But repeating episodes with no improvement from simple measures are clear signs something serious could be happening. If your body is changing its natural rhythm, there's a reason. Paying attention to these changes is crucial to avoid bigger problems later. Colon cancer, for example, can cause thinner, darker stools or hidden blood. Bladder cancer may cause a feeling of constant fullness or weak urine flow. Urinary changes in men are also common in prostate cancer cases. These symptoms shouldn't be seen as normal or just age-related, especially if new or persistent. Duration matters too. If bowel or urinary changes last over 2 weeks without improvement or explanation, seek medical advice. Simple exams like colonoscopy or ultrasound can clarify the cause. Prevention begins with paying attention to details. Even small discomfort when going to the bathroom needs your attention. Ignoring symptoms now may lead to irreversible issues tomorrow. Vigilance is your best health ally. Every sign has a cause. Ignoring it is a risk nobody should take. Number 9. Difficulty swallowing. Feeling like food doesn't go down right, gets stuck in your throat, or hurts when you swallow may seem minor, but can be serious. This difficulty might be caused by narrowing of esophagus, caused by tumors growing there and partially blocking food passage. It's common in esophageal, throat, or stomach cancers. Often, people adapt their diet, choosing liquids or soft foods, without realizing they're just masking a bigger problem. Changing eating habits doesn't fix the root cause. It just delays looking for a real solution. Meanwhile, the tumor can keep growing unnoticed. The longer you wait, the harder the treatment might get. Another important sign is persistent reflux or heartburn that doesn't go away with usual meds. These symptoms, combined with swallowing trouble, mean the digestive system is affected by something abnormal. Dysphagia, the technical term for this difficulty, shouldn't be ignored, especially if it gets worse. Your body is warning you something's blocking its normal function. Smokers or frequent drinkers have a higher risk of developing cancers in the throat and esophagus area. So if symptoms like hoarseness, pain swallowing, or a lump in the throat feeling appear, be extra cautious. It's a common mistake to think these symptoms are just temporary irritations. Persistence is a danger sign. Only exams like endoscopy can confirm serious changes. The earlier the investigation, the better the chances of successful treatment. So if you notice any swallowing trouble lasting more than a few days, the advice is clear. See a doctor. Your health depends on fast action. And remember, the worst sign of all is yet to come. In last part, I'll reveal the most alarming symptom, the one you should never ignore under any circumstances. Number 8. Abnormal bleeding. Unexpected bleeding anywhere on the body is a warning you should never ignore. When bleeding appears in places like stool, urine, spit, or vaginal bleeding outside your menstrual cycle, it might indicate tumors in early or advanced stages. The human body doesn't bleed without reason. When it does, something's altering its natural structure. This is one of the clearest signs something's wrong. With intestinal cancer, it's common to see dark blood in the stool, while bladder cancer may cause reddish urine, often confused with urinary infections. Coughing up blood might be linked to lung cancer, especially with chronic cough. Each bleeding type can point to a different affected organ. The key is not to treat it as isolated. Women with vaginal bleeding outside their cycle should get a gynecological checkup, as this could indicate changes in the cervix, uterus, or ovaries. Likewise, bloody sputum and chest pain when breathing can reveal serious lung issues. In any of these cases, the recommendation is clear. See a doctor as soon as possible. Quick diagnosis is the biggest factor in treatment success. Ignoring this symptom can be fatal. Many people self-medicate, thinking it's temporary. But abnormal bleeding is your body's urgent SOS. Waiting could cost dearly, sometimes irreversibly. It's crucial to watch for patterns, repeated bleeding, color, and if accompanied by other symptoms like pain, weight loss, or fever. Every detail counts. Although bleeding is just one among many possible signs, it's one of the most visible, and so one of the most important to act quickly. Stay tuned. because the worst and most dangerous symptom will only be revealed in the last part. It's silent, devastating, and often neglected. Number 7. Persistent cough or hoarseness. Coughing nonstop for more than 3 weeks without a clear cause like a cold or allergy is a serious concern. When cough persists and becomes dry, with or without bloody mucus, it needs to be checked out. This could be a sign of lung, throat, or larynx cancer, especially in smokers or those exposed to pollutants. Cough is a natural reflex, but when it won't stop, it's a clear warning that something's wrong. Hoarseness also fits here. If your voice remains altered for more than 15 days, even without pain, it might mean a problem with the vocal cords or something deeper, like a tumor pressing on the larynx. This symptom is often ignored, especially by people who talk a lot daily. But any persistent voice change should be checked carefully. Lung cancer may not cause pain at first, which means cough might be the only visible symptom for weeks or months. That's where the danger lies. No pain gives a false sense of security. Lung tumors can grow quite a bit before causing serious breathing trouble. Hoarseness can be an early, valuable sign of larynx or esophagus cancer. When these symptoms come with trouble breathing or chest pain, the risk is even higher. Unfortunately, many patients seek help only when the signs become unbearable. By then, the disease may already be advanced. The sooner the diagnosis, the better the chances of effective treatment. If you or someone close has these symptoms for a long time, it's essential to see a doctor. Exams like X-rays, CT scans, and laryngoscopy help detect changes early. Early diagnosis can make all the difference in how things turn out. Number 6. Skin changes or moles. The skin is the biggest organ in the body and often the first to show signs that something's wrong. Changes in existing moles or the appearance of new lesions should be watched carefully. One of the biggest signs of skin cancer is a change in shape, border, color, or size of a mole. And when a wound appears and doesn't heal, it's an immediate warning. Cancers like melanoma progress fast and can be fatal if untreated. The ABCD rule is a great guide to checking suspicious moles. A for asymmetry, B for irregular borders, C for varied coloring, D for diameter larger than 6 millimeters, and E for evolution when the mole changes over time. These are classic signs something might be becoming malignant. Spotting them early is key to increasing chances of cure. Skin cancer can show up in different ways: shiny nodules, scaly patches, bleeding wounds, crusts that don't disappear, and even spots with unusual looks. The important thing is not to ignore visible changes. Regularly checking your skin can be crucial to saving lives. Lesions on sun-exposed areas like face, ears, and hands are especially worrying. People with fair skin, family history, or heavy sun exposure during their lives are at higher risk. Protecting your skin with sunscreen and avoiding long tanning sessions are key steps to prevent this type of cancer. But even with prevention, you have to watch for signs. Sudden changes shouldn't be ignored. Self-medicating with creams and thinking it will resolve on its own are big traps. Any spot or wound that lasts should be checked by a dermatologist. A simple skin exam can catch malignant changes early. And in the last part of this video, I'll show you the most devastating sign of all. Something that often appears without drawing attention, but can change everything overnight. Number 5. Lumps or nodules on the skin, breast, neck, armpit, or groin. Finding a lump or bump on your body can cause anxiety, and rightly so. These formations are often the first visible physical signs of a growing tumor. A hard, fixed, painless lump that grows over time is one of the main signs of cancer. The most common places for these lumps include the breast, neck, armpits, and groin, areas with a concentration of lymph nodes and soft tissue. It's important to note that not every lump is malignant, but every lump needs investigation. The difference between a benign and malignant nodule can be in details: rapid growth, irregular shape, skin color change, and absence of pain. Many people ignore these signs because they think if it doesn't hurt, it's not serious. That's one of the biggest mistakes you can make. Breast lumps, for example, are a key symptom of breast cancer. Neck lumps in adults might be linked to lymphomas or metastases from tumors in other areas. In the groin or armpits, enlarged lymph nodes can indicate an infection response, but also the presence of circulating cancer cells. Checking your own body regularly is a simple and effective way to spot early changes. Breast self-exams, for example, are essential and can reveal changes even before pain appears. At the first sign of a suspicious lump, the right step is to see a professional and get tests like ultrasounds or biopsies. Early detection is always crucial for treatment success. So any change should be seen as a clear sign your body needs help. Don't underestimate external signs. They often reflect much more serious internal processes than you imagine. And heads up, the worst and most devastating sign is still to come. Don't miss the last part. It could be the most important moment of your life. Number 4, persistent pain. Pain is one of the body's main defense mechanisms. It warns you when something is wrong. However, when it becomes persistent with no obvious cause and doesn't respond to common treatments, it's time for serious investigation. Pain lasting weeks or months, especially in areas like the abdomen, bones, back, or head, may indicate tumors affecting nerves, internal structures, or organs. People often get used to pain and learn to live with it. They take painkillers, change position, reduce physical activity, but keep pushing the problem aside. This attitude is dangerous. Persistent pain can be the only early symptom of cancer, and the longer it lasts without explanation, the more urgent it is to investigate. Bone pain, for example, can indicate metastases. Continuous abdominal pain might relate to pancreatic, liver, or intestinal cancer. Frequent and intense headaches can be a sign of brain tumors. The common point in all these cases is persistence. When discomfort doesn't go away, there's a clear warning sign. Another important factor is pain location. Specific discomfort that always appears in the same spot without changing over time deserves attention. In many cases, the tumor presses on nerves or nearby structures, causing chronic pain. Even if the pain isn't strong, its persistence makes it worrying. You need to go beyond self-medication. Seeing a specialist, doing imaging tests, and following up are fundamental steps. Immediate pain relief doesn't mean the problem is gone. Something much bigger might be behind the symptom. Don't neglect what your body tries to tell you every day. Pain is a call for help, and the sooner you listen, the better your chances of healing. Number 3, frequent fever with no obvious cause. Having a constant fever, even if low-grade, without a clear cause like infection or inflammation, can be a worrying sign. Fever is the body's way to indicate it's fighting something, and when that something is cancer cells, the alarm needs to be immediate. In cases like leukemia and lymphoma, fever often appears without other visible symptoms, confusing patients and doctors. The big risk here is trivializing the symptom. Many link fever to colds or flu and don't investigate further. But when fever returns repeatedly over days or weeks or simply doesn't go down with antipyretics, it's a sign there's something bigger going on. The body is in constant alert, fighting a silent internal threat. In some cancer types, fever can show up as part of the B triad, along with weight loss and night sweats. These signs, when together, strongly relate to blood cancers like lymphoma. But even alone, persistent fever should be checked. It shouldn't be treated as just a side effect. Another point is that fever can appear intermittently, making diagnosis trickier. This demands careful attention to patterns, times it shows up, intensity, chills, excessive sweating, or malaise. Recording this info can help a lot in early diagnosis. Blood tests are the first step to evaluate infections or immune system changes. Then, more specific exams might be indicated. The important thing is not to wait until the situation worsens to act. Fever is common but can hide something unusual and very serious. And don't forget, the last part will bring the most important and dangerous sign of all. A symptom many overlook, but that's devastating if ignored. Number 2, excessive and constant tiredness. Feeling tired after a busy day is totally normal. But when tiredness is extreme, constant, and doesn't get better with rest, it's time to pay attention. Intense, unexplained fatigue might be linked to cancer cells altering your body's metabolism. This kind of exhaustion isn't just physical, it deeply affects your mind, mood, and energy continuously. Many patients say their tiredness started subtly but got worse until simple activities like climbing stairs or cooking became exhausting. This sign is common in several cancers like leukemia, lymphoma, colon, and even lung cancer. It shows a body burning energy in an internal battle, often without the patient noticing. Fatigue can also be associated with anemia caused by tumors affecting blood production or consuming essential nutrients. Also, tumors release inflammatory substances that interfere with normal body functions, worsening the feeling of weakness and apathy. It's an exhaustion that won't go away even with a good night's sleep. It's important not to confuse this tiredness with daily stress or emotional overload. When fatigue lasts weeks without clear explanation, it must be urgently investigated. If accompanied by weight loss, fever, or paleness, concerns should be even higher. These signs together are valuable clues of a bigger problem. The big mistake is thinking constant tiredness is normal because of age or routine. It might very well be the silent sign of a serious disease. So listening to your body is essential. When rest isn't enough to recover your energy, the cause might be beyond physical tiredness. And now, finally, it's time to reveal the most alarming symptom of all. The one that, when ignored, can cost a lot. Pay close attention to the next part. Number 1. Itching in intimate areas. Have you ever felt a persistent itch in the anal or genital region that just won't go away, even with creams or good hygiene? Know that this symptom, often underestimated, might reveal something way more serious than a simple irritation. Most people tend to ignore it or think it's temporary, but when this itch becomes frequent and resistant to basic care, your body might be trying to warn you about something serious, the beginning of cancer. Constant itching, especially around the rectum, anus, or vulva, demands extra attention. In many cases, this discomfort comes with additional signs that shouldn't be ignored, like redness that won't fade, small wounds that don't heal, occasional bleeding, or even lumps. These are typical symptoms of cellular and inflammatory changes that, if not detected in time, can evolve into serious cancer cases. Cancer in these regions often appears quietly at first, and persistent itching can be one of the first signs. That's why it's crucial to watch not only the frequency, but also the intensity of this symptom. If after weeks the discomfort is still there, even after basic care and ointment use, the right move is to see a health professional. Self-diagnosing and self-medicating can delay treatment that needs to start ASAP. Often, due to shame or thinking it's nothing serious, people postpone going to the doctor. But when it's cancer, every day counts. Early diagnosis is one of the greatest allies in curing tumors and can mean the difference between a simple treatment and a long, tough battle. This itch might seem insignificant, but in some cases, it's your body's cry for help, trying to protect you from a silent evil. Don't ignore the signs. If you or someone close is facing this symptom, take action. Prevention and early diagnosis save lives every day. The human body has subtle ways to communicate, and it's up to us to listen carefully. Often, what seems small is actually the start of something much bigger. We've reached the end of the video, but this final revelation is the most important of all, because it's exactly this kind of symptom that tends to go unnoticed, making it so dangerous. If there's one message that needs to be clear here, it's this. Persistent itching is not just annoying, it might be a cancer warning. Don't stay silent about discomfort. Listen to your body. And above all, take care of yourself. And to keep getting the best videos for your health and well-being, subscribe to the channel. It exists for one simple reason, to help you become a stronger and happier person. And in the video now on your screen, I reveal the miracle drink that eliminates excess sugar and beats diabetes. To check out that video, just click on the screen. So, see you in the next video.